Hello, and welcome to the World of Autism podcast, a podcast about all things autism. I am Dr. Jeff Knight, and I'm on a mission to create hope, peace of mind, freedom, and confidence for these children with autism, and in serving their families to help create the happiest, healthiest versions of themselves. In this podcast, we dive deep in creating many different solutions, talking about resources, and providing insight and stories of hope for families that suffer and have challenges with autism. Please join with me, and I look forward to connecting with you. Hello, everybody. Thank you so much for being with us today on the World of Autism podcast. I am super grateful to be with Terri Herning and having her with us. She is an expert in all things autism. She herself has a son on the spectrum. And we are going to get into discussing specifically a wonderful tool and resource called the Ion Cleanse Foot Bath that is manufactured and distributed through a company called A Major Difference. This tool, this resource has been so impactful for so many families. Terri is an expert in understanding all the benefits, what it can do, and how it can help people. And specifically, where there was some studies that she was a part of that even showed how everyone on the study, 100% participants, saw improved benefits with their ATEC score, as significant as up to 50 to 70%. And I think there was even one in the 80% mark in terms of the improvements for their child on the spectrum. So let me give you a brief bio of Terri. Terri Herning is a dedicated advocate for the autism and chronic illness communities, working as a mentor, educator, integrative wellness coach, co-author, summit host, and motivational speaker. Her son's journey toward autism recovery inspired her to enter the integrative wellness field, aiming to support others on similar paths. Terri holds a bachelor's degree in psychology and a doctorate in traditional naturopathy. Since 2009, she has served as the director of marketing for New Beginnings Nutritionals. Alongside her son, Matthew, Terri co-hosts the podcast Our Impossible Journey, where they share their experiences and successes in improving autism symptoms and achieving what once seemed impossible. So grateful to have you with us today, Terri.
Thank you. It is really a pleasure to be here with you.
Yes. And so share with us a little bit about your background. So in that bio, we talked a little bit about your son's journey, Matthew, and tell us a little bit about that experience with him and where things started with you in getting into this world of autism.
My son, Matthew, is now 20, heading towards 21. It's so crazy to have an adult, man running around. And he was diagnosed with autism when he was 4, almost 5. And, back in those days, one, we didn't see early diagnosis like we do today. And it was also just a different world, right? Even when you think about being able to network and communicate with other families, we have the ability now to share information at a rate that was just unheard of back then. And so my son got this diagnosis, and I'm sitting in front of this developmental pediatrician. And, I knew there were certain things that Matthew couldn't tolerate in terms of sensory input, noises that would make him melt down. He wouldn't sleep. He was chronically constipated and had a very bloated belly. He reacted to so many different foods. He'd have red rings under his eyes. He was screaming most of the day and night. And so I knew there was something going on with him. But when we finally got the diagnosis of autism, we were told he'll never be able to live independently, that we as parents need to be prepared to look for a group home for him to live in. And that was the only prognosis or any information that was given. It was stunning. And my husband and I looked at each other and I thought, I have no idea how or what the future is going to look like, but I'm not going to allow this determination to be his future. Like there has to be something that we as parents can do. And so that really sparked me embarking on a journey to learn as much as I could about integrative and alternative treatments, because the mainstream medical community didn't have much in the way of offerings. And so
Right.
I found a Great Plains laboratory. They're now Mosaic Diagnostic, but at the time they were Great Plains. And I found a webinar with Dr. Kurt Wohler. And I listened, and I was hearing all of the correlations about yeast overgrowth in the gut and giggling and screaming. And I'm thinking, this is my son. All of
Hmm.
these patterns were exactly what I was seeing, but I had no idea what was going on with him. And I ended up working with Dr. Wohler, and he led our recovery journey. And so that was really the spark of what happened. And as we, went down the rabbit hole of understanding what goes on in our children's guts and how that influences what's going on in their brains. And as we began bringing in these alternative and holistic modalities, something simple like B12 injections and taking out gluten and taking out dairy and red dye and all of these different
Oh
additives,
yeah.
from his food supply, we started noticing amazing things, whether it was reduction in sensory issues, more language, better sleep, less meltdowns, like all of these different things that were wrapped up in the diagnosis of autism, but truly had underpinnings in biochemistry and
Hmm.
biomedical sciences that weren't being addressed in him. We were noticing amazing things. And that was what sparked my desire to, want to go forth and help other people, because how can you witness something so amazing and not want to help other people and share, what you learn?
No doubt. That's amazing. So that is quite the journey. So this all really started when you came, you said he was 4 or 5 years old, when
Yes.
really the symptoms started just getting so overwhelming and you started learning and understanding more. How soon did you start noticing improvements just by making some of those changes with diet, lifestyle, and understanding some of the other components that could be really toxic and create negative effects for his nervous system?
Well, and so some of them were profound and almost immediate, right? Like dietary intervention truly was one of those foundational pieces where we started with dairy because my mom intuition told me that that was really one of his big triggers. He would prefer to drink sippy cups of milk rather than actually eat food.
Hmm.
He what had a blunted pain response, so that opiate connection with those dairy proteins, and then when you combine that with leaky gut, it was the perfect storm. We had this very foggy, out of it, disconnected young child who wouldn't even respond in some cases when his name was called. So we just started like peeling back that onion, right? And
Yeah.
removing dairy, removing wheat, and noting what we saw, doing a lot of lab testing, and really understanding what was it for my son, right? So it was specific food allergies and intolerances. He had very elevated oxalate levels. He
Okay.
had, brain inflammation and gut inflammation, and he wasn't absorbing his nutrients effectively, even, when we could get him to eat healthy foods. So, some of the things like methyl B12 injections, for example, we noticed definitely better sleep and better language, dietary intervention. It was a whole host of things, and that's why diet, for parents out there listening and even practitioners, dietary intervention had its hand in improving so many different areas in our son. And even though he's 20, almost 21 now, he firmly still realizes the connections between what he eats and how his brain functions.
Yeah.
And it's such an important concept for parents to understand the power of nutritional intervention. And, you know, as I'm sure you know, not everything was a home run, right? We
Sure.
tried a lot of things, and some things we totally struck out on, or even, caused regressions. It was not a linear process for sure. It was very much trial and error, and seeing how he responded. So, it was not linear by any means.
Right. And it never is it? There's always going to be those obstacles and different challenges, but I admire so much you and your husband and your effort in helping and doing what you can, and yeah, recognizing how powerful the diet is. It's something we all can influence, and something that can be probably one of the easiest ways to implement things right away, such as in your case, go off dairy, and so amazing what can happen just with these little changes over time, and how it leads to something big, to where now your son's 20 and a full functioning member in society, correct?
So I'm so proud of my son. In case you couldn't already hear that in my voice, he is going to community college.
Yeah,
He was awarded Student of the Year in Writing and Literature just a few weeks ago.
that's wonderful.
And he's an Eagle Scout. He is learning to drive. We're working on those independent living skills, but I have no doubt in my mind that he will be living on his own. He just got his first job. So he is loving that, and he is just doing amazingly well.
I just I am so happy to hear that, and congratulations on just the progress, the effort, the hard work, the blood, sweat, and tears that has gone into this. And hats off to you, and hats off to him. And wow, what a wonderful thing. Thank you so much for sharing that background with us. And that leads me into how the main topic today is about the Ion Cleanse Foot Bath. And I'm curious, where did this come into play? But also, if you could give people a background as far as what that even is. I know there's a lot of questions that people have, speculation with, like, does this even work? Is it really happening the way that people say it happens as far as detoxing things from the body? Um, let's dive into that, and feel free to take some time to share some thoughts and your experience with all that.
Absolutely. And, this was one of those modalities. So my son was older when we were introduced to this technology. And to be honest, I would be working conferences for New Beginnings or the Great Plains Laboratory. I worked for them as well. They were sister companies at the time. And I was highly skeptical. In the autism community, parents get sold a lot of things, and some of
Mhm.
them have validity and science behind them, and some don't. And as a result, I really kind of steered clear. I didn't know how this technology worked. I would see the tubs with all of the different floaty things and colors, and I thought it was a little bit hokey, to be honest with you. And so
Yeah.
I am a part of an organization called the Thinking Moms Revolution, and Ion Cleanse by AMD came to that organization, and they said, we would love to study what our technology can do in the autism community. Well, my hand immediately went up because I was so critical of what I thought was, a scam. And so I thought, with my relationship with Great Plains and my ability to access laboratory testing more frequently than the average parent, I would love to take part in a study and look at basically how I could debunk this technology. And so we received our unit just before, no, I'm sorry, just after Christmas time. And so my son had gotten a game, a toy for Christmas called the Perplexus ball. And it's
Okay.
this like clear plastic ball with almost like, if you remember Mousetrap back in the day,
Yeah.
that game. And it has a little BB, and you have to rotate this ball 360 degrees to get it through the little mousetrap like contraption inside to the end. Well, it was to I don't know, complex for him. And so he had immediately given it to his younger sister. And
Right.
so my husband and I got his cleanse ready. We get him all set up. He does his very first cleanse, and we're dumping the tub. He goes into my daughter's room, gets this Perplexus ball, came back to the dining room table, calmly sits down and starts playing with this toy that had previously been, not something that he wanted to engage in. And so, I'm really skeptical at this point still. And I look at my husband and I'm thinking, okay, so what's going on here? And he was at a point, and we'll talk about his ATEC, and I'll
Yeah.
share his response. We were at a point where he was in a mainstream classroom. He was beginning to phase out of therapies. He was, in my estimation, very far along in his autism recovery journey. But there were still small things that we were looking to optimize, being in affiliation with Great Plains Lab, looking at lab testing related to detoxification, chemical exposure. We had done sauna therapy, we had done glutathione, we had done a number of detoxification practices with little results. And so with that in my mind, we engaged in this. And it was really interesting because one of the other pieces about Matthew was that he would respond when talked to, but he wouldn't proactively engage people in conversation. So again,
Okay.
following the first cleanse, after that, we get in the car and he turns to his sister and he says, "Do you want to play I Spy?" So from the very first cleanse, we started noticing improvements. And so
Wow.
let me back up in terms of what we did prior. We were asked to do the ATEC score, as you referenced in
Yep.
this, right? That stands for the Autism Treatment Evaluation Checklist.
Hmm.
And the standard mechanism is, the higher the number, the more severe the autism. And under 10 is generally considered recovered. And so Matthew's score at the start of this was a 25, which
Okay.
again, I,
That's still pretty low.
it's pretty low. And I don't have really a scoring from when he was first diagnosed or really severe. So I can't give you any reference, but we have been far down this path of biomedical intervention and done years of dietary intervention, supplementation, even prescription medication where appropriate, to address gut dysbiosis and viral issues and things like that. So here he was at a 25. By the end of the 120 days of this trial, his ATEC dropped down to a 3. So as you
Wow.
mentioned, some of those kids that had in the 80s, Matthew was one of those kids. His ATEC dropped by 88%. And, for me, that was super meaningful because, and when we talk about this study, I think it's really important to highlight the fact that this group of children and this group of parents that were in the first and then the second study, and I can talk about that one as well if you'd like, we
Please.
were hardcore biomedical parents. These were not, parents of newly diagnosed kids who had not tried a lot of interventions. Between us, between the, all of the 20 something families, we probably collectively had done most of the mainstream and or alternative holistic treatments for autism. And so for many of us, we had taken our kids really far with what we had done, and we were
Hmm.
looking for the missing piece that was going to take us even farther. And so
Right.
for Matthew, the improvements that were really moved the needle is, we were doing a probiotic that was a soil-based organism probiotic that he was not able to swallow capsules at the time. So I opened up and mixed with a little bit of water, and they were black, and it would leave a biofilm residue at the base of his gums and on his teeth. Over the course of this treatment of the ion cleanse, we noticed a reduction in oral biofilm. We noticed improvements in handwriting. Like I mentioned before, kind of that executive functioning, that ability to kind of work through challenging or stressful environments really got better, as well as his wanting to proactively connect with people. So, not just respond when he was spoken to, but go out of his way to really connect with other people. And,
Wow.
those were super, super meaningful. Now, over now, we've done this therapy, gosh, for 10 years, something like that.
Right.
It's still one of the first interventions that he will ask for when he's stressed out, when he's starting to get sick, when he's not sleeping well. So it is a part of our ongoing family protocol to this day.
That's wonderful. Yeah, and I love that he even recognizes that, where he's asking for it. Anytime you see that, it's clearly means something, right? Because how many kids want therapy? How many kids want another treatment or another supplement? And yeah, this even requires having to sit still for 30 minutes, right? So sometimes longer, depending on what you're doing. But the fact that he's willing to do that and he sees it, that speaks for itself.
Well, and you bring up a really important point because we had a private Facebook group where we could all share our experiences and what we were seeing in our kids. And even the nonverbal kiddos would go to the tub and drag it out and non-verbally request. And that was actually how the cleansing protocol schedule got tweaks as a part of our first cleanse group,
Okay.
because it originally was every other day, and
Right.
then our kids were really requesting it more frequently. And so it ended up being adapted to where it was 3 days in a row and then take a day off, and then 3 days in a row and take a day off. And when I began my own practice as an integrative wellness coach and bringing this into my own clients, if I had someone who was dealing with any sort of chronic illness or, hadn't cleansed with any regularity, that was generally the cleanse schedule that I would recommend is, and even if they couldn't come in 3 days in a row, getting in a couple of days in a row or several times a week. That's why having a home unit was so convenient, because
Sure.
you're able to do it in this frequency and then really tailor it based on what you were feeling. And so in our first group, we had a variety of older kids, younger kids, and it really kind of spanned. So then, when we saw the tremendous improvements in all of the kids of this group, Ion Cleanse by AMD said, you know what? We want to look at this again. We want to look at another group of children. And there's a prevailing message out there, which I really dislike, is that if you don't recover, I'm using air quotes here, right?
Yep.
Don't make improvements in your child by what? Kindergarten, age 5, age
Right.
whatever. There are all of these really interesting arbitrary guidelines or boundaries that if you don't make significant progress, that you're not going to, right? And so
Mhm.
again, I feel like it does such a disservice to parents, especially related to having hope for improvement, which I also feel is a really important component to this journey. It
For sure.
really squashes that, right? So Ion Cleanse by AMD said, let's see what we can do with these older kids. And what they found was exactly the opposite of what this prevailing messaging was, which was the older kids had an even greater reduction in ATEC scores when they engaged in the
Yeah.
Ion Cleanse by AMD technology. So it was even more exciting because those older kids, there's a term for them called non-responders, right? Which again, conscious language here, right?
Sure.
Could it be that they're non-responding to some of these other treatments because their detox pathways are so impaired, and that this technology enables their body the freedom to be able to liberate and excrete the toxins, allowing greater absorption and utilization of nutrient therapy, right? And, being a director of marketing for a supplement, distributor, I am a huge fan of supplements.
Mm-hmm.
But if those cellular receptor sites are bound with toxins and the ability to communicate in that cell is not at its, peak, then you're going to get less efficacy of those supplements. So we spend a lot of time pushing supplements in. But if there's not the receptivity for the body, then you're wasting a lot of resources and effort on, low return from a
Right.
parent's perspective.
No doubt. That was a beautiful breakdown of everything with that study and with what you experienced, and amazing to see all the positive improvements, especially like you said with older kids, because I've heard that too. Is once you hit a certain age, then good luck. You can't expect a whole lot of improvement. That how important it is to catch autism at such an early age. And yes, of course, we can all agree on that. But to know that there's a resource and ways to help everyone on the spectrum, no matter what age they're at, this is really promising and so impactful. So I have a question that I know a lot of parents have when it comes to this, and even I know you and even myself. I think we've had some skepticism with how this works. Some people wonder, like, okay, does this mean that when I put my feet in the bath and you start to see the color changes, does that mean toxins are coming out of my feet into the water, or is it and can I take that water and sample it and see if there's any toxins there, or is this more of something that is going to facilitate the body's physiology and how it's actually eliminating from the inside out and helping improve kidney function and other things like that? So if you could explain some of those common questions that people have when they're looking at this, and like you said, you said you thought this was a little hokey at first, and clarify some of those common questions and answer that for us. That'd be great.
Absolutely. And it's such a common question. When I have, as a part of us having a practice, we did a clinical trial using the ion cleanse by AMD and looked at glyphosate excretion and, some other things. I've written up a case study. So I've presented in front of parents and practitioners alike, and I get this a lot.
Mm-hmm.
And it is an absolutely valid question because, again, when we talk about the realm of treatments out there and integrity, we all know not everybody operates within the same framework, and so there are other foot baths out there that will try and tell you, gosh, oh, that's coming from the liver, oh, that's liver detox and that's kidney detox. And my opinion, having been a mom, watching my own son go through the first trial and then working with clients and then doing a trial of our own, my focus was always on the human, right? The person. So in terms of looking at what is going on in the tub, that to me was very low priority. So when we looked at things, we looked at pre-testing, whether that's how do you feel, right? It doesn't have to necessarily correlate to labs, although, we certainly have done that as well. But the human experience prior to a cleanse, and then the duration of the cleanse period, whether that's one cleanse, whether that's in the case of our glyphosate study, that was 12 cleanses. That's it.
Wow.
We did a
Yeah.
4-week study and we did 3 cleanses a week. So, and then after, right? And so, where are we at the start? Where are we at the end? And can we compare that to a group that didn't test, right?
Yep.
So that has always been my main focus. And I've had other practitioners question me and say, why don't you test what's in the water? And frankly, I don't really care what's in the water. I care what's in the human, and are we making progress with moving them towards their health goals, whatever those are,
Sure.
right? Now, I have heard, again, anecdotally, that other people have tried to test the water and they found things or they haven't found things. And there are so many different components to water testing, right? Testing it prior to putting the unit in and activating the ions, what's in it after. Is the ionization neutralizing and changing any of the chemicals in the tub? There are so many confounding
Right.
pieces to that. So, what I will say is, I worry less about what the tub looks like at the end of the person's cleanse and focus more on how are they feeling and are we moving towards whatever they're seeking to achieve in their health journey. With that said, anecdotally, having done at this point in time probably thousands of cleanses on not just my own family, but clients and people at conferences and things like that, there are variations in the output at the end of the day. So you can start with the same water supply. You can sit 5 people down and have 5, pairs of feet in the water and have 5 different looking, smelling, everything tubs at the end of the same 20 or 30-minute period. So is there an element of individual detox in the tub? I suspect yes. Otherwise, the tubs would all look exactly the same.
Sure.
What that is or what that means, I don't really know. Again, part of this process for me was my own correlations on what I'm working on in my own health journey and what I'm working on with my son and my own family members or clients. And kind of piecing together, oh, I've been traveling and on an airplane. What does my cleanse look like? Gosh, I brought in this new supplement. What is this doing? Sometimes you notice changes as a result and sometimes you don't. So, the end result on that is I really, even though it's fascinating and it's interesting to look at the changes and the textures in the tub, I really encourage people definitely do not consider this any sort of diagnostic piece. And don't put too much energy into what the tub looks like at the end of their cleanse.
I think that's good advice. And yeah, definitely not something you can use as a diagnostic for sure. But it is funny when people make those comments. And I've heard people say they studied the water and they didn't see what they were expecting to see. And I think they are missing the big picture here. Because I don't think there's ever been any claims saying, hey, you're going to detox everything out of your feet. But it is a very good point that you make, that you can have 5 people next to each other and you'll see something different. I mean, I've seen in myself and even with some of my patients that use this, where one person will have some black flecks in the water, and then someone else it's maybe a more kind of a greenish orangish color, and someone else it's maybe more of a brownish color. So there's clearly something happening and something different with each person. But I think your experience with your son, that very first one, it speaks for itself with how big of a change you notice, even with one foot bath, where he was then engaged in that perplexus game and then engaging with his sister and actually initiating conversation and inviting her to play a game with him. I mean, that alone, I think, is enough for any parent and any family member, is to see those changes, because that's what we want the most, is to have our child to be able to interact, to have that social engagement, to feel more connection and more love. And if you're seeing that, whatever the treatment is, then I say wonderful, keep doing it. And I think that's really wise advice with what you shared. Thank you.
Oh, you're welcome. And to your point, you mentioned something that sparked a thought. One of the parents in that first study, because as we were going through this, trying to really move through uncharted territory, AMD, a major difference, said families use the unit for your whole family, not just your child with autism. One of the moms in the study group, she only had one kidney and she had some significant health challenges as a result of that. she would use the unit consistently. And in her words, she felt that it provided that additional support that her body really needed. So, to your point that it, really is about supporting the body in its own natural detoxification process, right? We can't expect that all of the magic is happening in the tub. And as a matter of fact, what they have found in other studies is that your detox process is ramped up for about 3 days post a single cleanse. And
Okay.
so you can be more, I felt, more effectively excreting through the normal pathways. I've had people who do not sweat as a general rule, which we know is not a good thing. Sweating is one
Right.
of our detox mechanisms, who will do a foot bath and immediately begin sweating, and so it's important to be drinking adequate water and making sure those kidneys are getting, the support that they need with adequate hydration. It's important that your bowels are moving, all of those normal ways we detox. It's super critical to maintain that, because I think this modality supports the body's natural mechanisms of detox.
Yes. Yeah, and reading that study that you were a part of, it's been really fun to look at some of the comments from some of these parents. And there was one here that I wanted to share that I thought was really insightful. This was, let's see here, where was it? I mean, they're all great. Yeah, here's one. This is a female. She's 11 years old, and she had a 41% improved ATEC score. She did the protocol that was the 3 days on, 1 day off. And it says here, something is working when you have extended family and teachers are consistently commenting on her overall improvement in social and cognitive development and saying, keep up whatever you are doing. We are beyond grateful to AMD for giving us hope at recovery and improvement, even at 12 years old. So, anyhow, I think, and there's so many more of those types of experiences. But for individuals that have never tried this, what would you recommend would be a good place to start? And I mean, are there many clinics throughout the country, throughout the world that are using this, and or how easy is it to get one of these devices in the homes of families?
It's a great question. And if you go to the A Major Difference website, they do have a practitioner finder or practitioner locator. And so you can put in your information and you can seek out where there are practitioners that have this modality. Conferences. So, autism families, if you are attending conferences like the TACA conference or Documenting Hope, some of the larger conferences, AMD usually has a booth there, and that's a great way to also try it. And if you bring your child, have your child try it out. But one of the things that I really appreciate as an autism parent, first and foremost, is the integrity of the company and the fact that they have a trial period. And so within the first, I think it's 60 days, if you are not seeing what you want to see in that, in that technology, you send it back and you get a 100% money back guarantee. And there aren't too many companies out there that stand behind their product to that level, to where they want it to be successful for you as well. And if it's not, they want to give you your money back. And in
Mm-hmm.
today's economy, and really any economy, as a special needs parent, our budgets are always spread thin on what we want to do and what we're hoping to achieve. And what I would counsel my own clients in is, let's come up with a cleansing protocol that allows you to really put this unit through its paces. And if by the 60 days you are not convinced yourself, then you need to send it back and get your money back. Because I always look at my client's budget like I would look at my own home budget.
Sure.
And Most of the people that bought units that were, clients of mine or friends of mine, family of mine, they kept the unit. No question there. But that safety net is built in because by 60 days, you're either going to be seeing something or you're not. And so you'll know one way or another. So trying something in a clinic is a wonderful option if that's available to you. If not, purchasing a unit and knowing that they have this money back guarantee is also kind of that second best. I know that for many families, as an autism mom, my son had his metabolic challenges, but the saying, the apple doesn't fall far from the tree, is really, really true. Whether we're talking about mitochondrial issues or issues with toxicity, oftentimes we need some support in this realm as well. And
Yeah.
this modality has been amazing, not just for my son, but for my whole family. And like my son's experience of wanting to get that as soon as he doesn't, feel good, or definitely if he is sick with something, that goes for our whole family. Or even if I'm feeling run down or whatever, it's one of those modalities that I will do even before other modalities, or in combination with other modalities. So it's a great tool to have in your home toolbox if you can do that.
Yeah. No, I love it. And it is so convenient too. I mean, you just get the tub filled with water, stick the ion applicator, I don't know what to call that, that
CRA.
that you plug into the wall and set the setting, and you sit there and hang out for 20-30 minutes, read a book, watch a movie, draw some pictures, whatever. So it's pretty convenient and definitely very, very easy to use. So this has been wonderful, and I really appreciate your expertise and your experience here. Are there any other aspects that you feel like we need to bring up that we haven't talked about so far in connection to this topic today, Terri?
There are a few contraindications. So, families looking at trying this, if your child relies on a medication that requires a constant level in the body, like seizure medication, for example, organ transplant medication, or they have a pacemaker, then this is contraindicated. And also pregnant women, breastfeeding women, anything that is related to detox is discouraged during that period in a woman's life as well. But really, I have just been so astounded at the gamut of what people feel after their session or a series of sessions in terms of better sleep, less feelings of anxiousness. I've even seen kiddos who were very much living a life in fight or flight finally be moved into rest and digest by
Mm-hmm.
using this technology. And that alone, our body can't detox when it's stuck in that sympathetic dominance response. So even the simple act of helping the body move out of that sympathetic state into parasympathetic can help spark detoxification and improved wellness just in and of itself. And like you said, it's a really relaxing thing to engage in. And they do make a tub as a result of I think our first or second study. They even make a tub lid that has little feet cutouts so that if your child doesn't like the sight of their feet in the water, or if they're using an iPad or another device and you're worried it might fall into the tub, they have a really great lid that has two little cutouts for teeny tiny little feet. And honestly, the youngest client that I've been able to support with this technology was 19 months old.
Oh,
He's
wow.
now just turned 9 and doing amazing, again, not just ion cleanse, but considering it as a piece of an overall wellness and detox protocol has been the biggest gift for so many families out there. And certainly there is no one end all be all. There is no one modality that is 100% beneficial for every single person who tries it. But I really encourage parents to look into this modality, because when I look back of over all of the spectrum of things that we've done and tried, I honestly wish I knew about this at more of the beginning of our journey, because I feel like it helped open up his pathways in a way that made those nutrients much more available to his body and his cells. And in fact, after doing years of methyl B12 injections, it wasn't until we had done this initial study and continued to do ion cleanse that finally we were able to stop seeing those markers on labs that said his body needed more B12. And we were able to
Wow.
stop doing B12 injections. So, I mean, those things where it's like, we've been doing this. We've been, we knew what the past looked like. And so being able to bring in another modality and make change at that level in my son's story is something that I will forever be grateful for.
That's great. No, I love that. That is so neat to hear that, and I'm glad that you encourage these families that are listening to realize there are multiple ways we can help our children, and this is one of those that it would be. I think for me, it's a no-brainer to at least try it, right? Because it's so safe. There's no real risk to it. I don't know of any. You mentioned the contraindications, which I'm grateful you brought that up, because we don't want anyone to put themselves in a situation that could be harmful. But other than that, there's really no risk, and it's something that really is just so effective and simple to do. Um, the other thing I wanted to ask as well, what would be, having been through this journey, what are some other pieces of wisdom or advice that you could give a family or a parent that is maybe new to this journey, or maybe they feel like they're stuck? What words of encouragement would you give to that mother or father?
I think first and foremost is don't let anyone set your child's future for you.
Mm,
Don't let someone limit what your child's potential is based on any diagnosis. And really take empowerment of this journey, tap into your intuition as parents, because at the end of the day, we are the ones that have to administer the supplements and do the diet and do these different modalities. And it's really our job to manage all of the wonderful practitioners that are helping us achieve this goal for our children. And if there is someone that's on your team, whether it's a teacher or therapist or practitioner, that cannot see a future that you're envisioning for your own child, fire them.
yeah.
And I don't mean to be harsh, but you need to be surrounded. Your child needs to be surrounded by the people that think that they are going to succeed and that they are the wonderful, amazing, competent being that they were born to be. And if you're not getting that support, or somebody is not seeing the vision that you as his parent sees, then remove that person, because it's really important that we stay focused. If we lose hope, what hope do our children have? And so it really is
So
up
true.
to us, and it's really important and does such a disservice when we hear people naysaying what our kids can achieve.
Oh, I love that. I think that's such great advice. So helpful, because a diagnosis does not determine our destiny, right? And and I know we can get caught on certain labels, and we can get caught on someone else's perspective. And you've mentioned it prior to this, this last question, how you followed your mother's intuition multiple times. And I think that is so important for families to realize, is to hold on to that hope, hold on to that knowledge that things can get better. You do not have to stay in the situation you're at. There is always room for improvement. It's the a comment that I've used many times, is you don't know what you don't know. And when you learn about these great techniques or strategies, it's almost like this awakening of like, wow. And you yourself even said, I wish I knew about this sooner. So I'm so glad you gave that advice to our families that listen, because that's so important. Thank you so much. This has been incredible.
It has been my pleasure. Thank you so much for having me.
You are welcome. And I am just honored to have you here. I would love to have you share. So, if people are interested in purchasing a foot bath for themselves from a major difference, what would be the best way someone could go about doing that?
They can go right onto the website or call. They have a great customer service team. Their website is amajordifference.com.
Perfect. And you mentioned that you do some coaching and consulting and therapeutic work with your clients. Share with us a little bit about your business and where you come from, as far as if people were really touched by what you said and where they resonate with you. My goal is to help people find the right person to help them. And who knows, maybe someone listening to this will say, I want to engage with Terri. How could they contact you?
You can go to my website, which is terriherning.com, and there's a contact form. You can also check out the podcast that my son and I recently started called the I'm Possible Journey podcast. And really connect with me that way. And yeah, and go, if you're at one of these autism conferences, usually I'm there. I'm
Yeah.
either there for new beginnings, or sometimes I'm there with a major difference, talking about all of the different resources that parents have at our fingertips. And I know it can be overwhelming and confusing, but there is such a community of driven, passionate, educated parents out there. So do not hesitate to reach out and make contact with me, for sure.
Awesome. Well, thank you so much again, Terri. This has been a wealth of information. This has been an incredible journey as you've shared your experience, your insight, and the great wins that you've witnessed with your own son. So you have been in the trenches. You know what you're doing. You can talk the talk and walk the walk. So I love everything you've shared today. This has been wonderful. Thank you so much.
Thank you. It's been a pleasure.
You bet. And thank you, everyone, for listening to this podcast episode today on the world of autism. Please share this episode with other families and friends that you know that might find value with this content. And don't forget to subscribe to our podcast and give us a rating as well. We are grateful for all of you in connecting with us. Have a wonderful day. Hey guys, wasn't that an awesome episode? I just wanted to share a few takeaways that I got from listening to Terri talk about the Ion Cleanse Foot Bath. First of all, the thing that probably stood out to me the most was how often we hear that older kids that are on the autism spectrum will not improve once they reach a certain age. We found that through the Ion Cleanse Foot Bath and the research that was done, that individuals in their teenage years were seeing significant improvements with their ATEC score. So the ATEC, again, is the Autism Treatment Evaluation Checklist. And with the two different studies they did, the first study, the every other day, where they did the foot bath, they had an average of a 35% reduction in the ATEC score. And the other study, the second one, where it was 3 days on, 1 off, they had an average of 55% reduction of the ATEC score, which is absolutely significant. So 100% of the participants found benefit from using the Ion Cleanse Foot Bath. Absolutely incredible. I love to hear that her son, his handwriting even improved. He had a stronger desire to connect with people. I mean, this is one of those tools that I think when you have tried so many other things, this is one you have to try. And I love that they have a money-back guarantee. So remember, their website is amajordifference.com. I'm also supposed to let you know that I don't work for A Major Difference. However, I am an affiliate, so if you do end up purchasing a machine from them, I am rewarded from anyone that finds them through this podcast. Wanted to make sure you guys knew about that too. We'll talk to you soon. Thanks, guys.